Today we talk about teenage pregnancy. Teenage pregnancy, by the definition, is the pregnant woman aged between 13 years old to 19 years old. So this is a UNICEF definition. So factors that associated with increment of teenage pregnancy rate currently is because of, first is low socioeconomy. Number two is and they are more to living in a care home, no parents guidance, right? And then number two, they involved with the crime. Some of them involved with crimes like misuse of substance, and then multi-sexual partner, prostitution, right? And then homeless, also associated factor also. And low educational level, stop school, and patrons, children of teenage mother, because her parents also is a teenage parent also. And then maybe associated with some of them associated with the sexual child abuse. Okay, during childhood they had sexual abuse, and then they tend to depress. In term of that, they associated high risk to problem, the medical problem they associated with the teenage pregnancy. First is a sexual transmission disease. Number two is a nutritional problem, anemia problems, and about psychosocial problems. They had a highest chances to get postpartum depression because don't know how to take care of her children, and most of them is unemployed, so they lead to financial burden for them. In terms of pregnancy problems, they had tendency to develop preeclampsia, then a molar pregnancy also because of extreme age, and illegal abortion because some of them associated with the unmarried status, right? And they tend to skip the antenatal follow-ups and unbooked pregnancy. So about the anemia in pregnancy, about the fatal complication, they associated with the SGA, fetal growth restriction, premature delivery, and then spontaneous miscarriage and congenital anomaly. So about the congenital anomaly, the most common congenital anomaly happen in the teenage pregnancy is a gastroschisis, right? So unknown the etiology. So that's why in the extreme age, we advise to do the detailed scan also if we suspect any abdominal wall defects. Okay. Other than that, alright, the risk factor that why they try to escape the antenatal follow up. First, because of they think the antenatal follow up is not important, right? Not important. And number two, there is a difficulty to access to antenatal clinic. Okay, maybe they didn't have the times or transport or no companion, right? At the same time, they have financial issue, maybe don't have enough money to go to antenatal clinic. Fear, and then they also afraid to the doctor and medical staff. Embarrassment, that's the main idea why they escape the antenatal visit also. This embarrassment because most of them is unmarried pregnancy. So how to prevent this thing happen? Okay, so preventing the pregnancy. So the first strategy is you must prevent the pregnancy itself by the adequate sexual education, and then religion approach. That's the important part. Okay, another one is contraception accessibility. So when we talk about the contraception, so advisable to give a long active reversible contraception plus with condom. Is a double dash method, right? Because long action is the effective one to reduce the pregnancy, and then but the benefit of condom is a reduced sexual transmission disease. Number two, to prevent the problem related with the pregnancy, such as a social support and family support during the pregnancy itself. So and then financial support, so we must assess the financial issue, and maybe we can refer to the social welfare. Because the importance of family and social support to improve the motivation to them, and at the same time it benefit to compliance with the antenatal follow up. Education, what the education how to breastfeeding is important also, and then how to take care her children after delivery is so important, and contraception education. uh, alright, in term of that, the antenatal service, they provide a lot of benefit to teenage pregnancy. First, during antenatal service, what we can do is we can identify any we advise for early booking, right? So to detect any problems during the antenatal booking. Okay, during the early antenatal booking is first, the benefit is the confirmation gestational date. Right, that's important. And then screening. So all the screening, in fact, the screening, because there are tendency to sexual transmission disease, because in view of multi-sexual partner. Sexual healthy screening is for example, like others like hepatitis B, Hep C, HIV, syphilis, and gonorrhea. One is other common is chlamydia trachomatis. The concepts of screening is a simple, painless, and result must be confidential. So that's important, because they and then to reassurance but there is a treatment for the disease. In the antenatal clinic, we can teach them, we can educate them about the importance of sexual health screenings. Alright, and then we can follow up about her disease. Number 3 is we discuss the high risk behavior, maybe because they are tendency to smoking, alcohol consumption, and misuse substance. So because these things is associated with high perinatal morbidity to baby, okay, especially alcohol, okay. And then so we can refer her in the smoking also, is we can have counsel her regarding the adverse effect of the alcohol, smoking, and drug misuse substance, right? So we may refer them to smoking clinic. We have a smoking clinics. Right. Number 4 is during antenatal clinic also we can access nutritional support. How the nutritional, because most of them is malnutrition, maybe due to of financial issue, and because of too burden for them to things other things. Right. So about the financial social nutritional support, so we can provide the good nutritional support, supplement, vitamin C supplement, and advice about the nutrition. Okay. Other than that, during the antenatal clinic, we can assess the mental status and health status. And then because there are tendency to have a postnatal depression 3 times more higher than the advanced maternal age woman. And then beside that, we can detect her early if you suspect any psychological stress or psychological problem that impact her pregnancy and harmful to the pregnancy itself. So we may refer to psychiatric, and then psychiatric assess there is a role of termination of pregnancy, because if too stressed, too psychotic for them, right, at this moment there's the option of termination of pregnancy. That's the important about the how to prevent that also, that the main play role of the family for support. During the antenatal visit also, okay, we can teach them about the breastfeeding class and the contraception, and then the benefit, and then maybe we can try to contact the school and college to continuation of the study after pregnant. That maybe we can do. Right, I already talked about the contraception. Others wise is okay. So about the teenage pregnancy, so maybe school can also play a part to prevent the other strategy, can reduce the teenage pregnancy. First, school can do the learning support to those who had the academic problem. You suspect early have a social problem, the school, the educational system maybe can help them to identify this group of student. Okay, early identify of social problem is important also. At least we can overcome this issue later, and maybe the school can provide all the voluntary programs and extracurricular activity, because so they can busy with that activity, and then maybe school also can support those who had the family problems, or family breakdown, mother and father divorcee. So in conclusion, so the teenage pregnancy actually we can prevent or reduce uh, in term of contraception and sexual education first, and education. So public awareness is important at this moment, and public and society is also play a role to reduce and prevent the teenage pregnancy. Parent guidance is important also at this moment. But as us, we can advise for contraception method and problem during the pregnancy. We can reduce the risk. That's all about the teenage pregnancy.